Ibtisam.
Thank you. My name is Ibtisam Azim, Al-Arab Al-Jadid newspaper. I have two questions. In your remarks today, you talked about accountability. Remarks to the fourth committee, you talked about accountability regarding UNRWA staff and also your facilities. Could you elaborate a little bit on that? How would accountability look like for you? And then also on the issue of the role that UNRWA could play when it comes to implementing the New York Declaration and the Trump plan, and whether you are in contact with any Americans here in the UN or in Washington.
Thank you. I mentioned this morning, but I mentioned many times about the need of accountability. I think we have seen that the UN has been blatantly disregarded during the last 2 years. By any account, you look at the number of humanitarian workers or UNRWA workers who have been killed, the number of premises which have been damaged or completely destroyed. They have been also been used for military purposes during the last 2 years. So yes, we need accountability. Now, over the last 2 years, it was very difficult, to assess and to be on the ground and to do fact-finding. I'm not saying that the conditions are fully met today, but this is something we have to keep in our radar. We need accountability when it comes to the UN, on the which form. There are various instruments. The starting point could be at least a type of a board of inquiry. That's what happened already in the past. But this is more a kind of administrative type of inquiry. And more broadly, I think, if we want to promote any lasting peace, I don't believe that we will succeed if we are not going through a delivery of justice and healing. And we need at one point to find ways to recognize the scope of the atrocities which have been committed. So my answer this morning was that indeed we need to define the best shape of accountability. One is related to UNRWA and to the United Nations, for which I don't know yet what the answer would be, but most likely we might wish to start with a board of inquiry. Now, when it comes to the New York Declaration or the 20-point plan of President Trump, I believe that an agency like ours can deliver in the primary expectation that the community and the population will have. Today, of course, everything is a priority, but we, as a service-oriented, focused agency, we can deliver our share when it comes to the broader public health and the education. And if you cannot ensure a minimum of public health, and public health is not just consultation in primary health center, but it's also waste management, some municipal services, access to clean water, preventing communicable disease, and so on. That's a focus where we, as civil servant-like expertise or workers that we have, can deliver our share. And the second one is definitely education. Later on, and this was also a question being asked this morning, is what role can the agency play in building up future capacity of a Palestinian institution? And I do believe that in our area of focus, the agency indeed has to work hand in hand with our PA counterpart to make sure that we are building up, in fact, this capacity in the future. And that would be our contribution, in fact, to any efforts of stabilization.
I'm sorry, are you in touch with any
We are in touch with CMCC, the operational coordination body, which has now been in place.
Farnoosh?
Thank you. Farnoosh Amiri with the Associated Press. My question is also related to Ibtisam's. The Secretary of State of the U.S. has said that UNRWA will play no role in the future of delivering aid in Gaza as part of President Donald Trump's plan. Given what you just said, it doesn't seem like that is what UNRWA is doing right now. You said you're mostly focused on education and public health. Has any of your work been impacted or impeded by the last few weeks when the ceasefire took place and that the CMCC is now operating around the borders?
Since the ceasefire is in place, we have expanded our services, scaled up our services. Now, it is true that the agency continue to be constrained when it comes to bring in supply, when it comes to bringing in food. But I keep reminding colleagues, an humanitarian response is not just food distribution. If you want to address even the hunger and the despair in Gaza, it's not just through food distribution. It's a comprehensive response, and as an agency, we can focus on services. Services being, again, primary health care, being waste management, psychosocial support, access to clean water, some municipal services where we might repair pumps and canalization on the ground. So these are the kind of activities the agency is primarily focusing on. We do some food distribution with partner, mainly in the shelter that we are managing because, as I said, we have 75,000 people in our premises so far. So that's really the focus the agency is having now. Obviously, we are also looking at on how can we bring our supply into Gaza. You heard me last time when I was highlighting that we have the equivalent of about 6,000 trucks in Egypt and in Jordan. This is not yet in, and we are looking at with the other partner of the UN and also with the CMCC how this can be brought in. It is, again, when it comes to the movement into Gaza for the agency, we are under a number of restrictions, as you know, which are very much related to the piece of legislation in place in Israel.
Deji?
Hi, Mr. Lazzarini, Shudaj with China Central Television. I have two questions. We know there's a funding issue of UNRWA. You just mentioned you're the largest employer in Gaza. You have 12,000